Have you ever experienced a time when your shift is half over, you have an extensive amount of charting to complete, you still have 3 patients to see, 2 of which still need meds, and you have to take your lunch? You probably begin sweating, your heart races, your head feels full, and you become agitated. As you may have guessed, this joyous phenomenon is known as stress, and a large majority of us experience it daily. From finance and work to relationships, life is full of reasons for us to be stressed. Today, I want to inform you about the effects of this stress on your health and also talk about everyday ways to cope with it and minimize its health risks. Let's discuss some of these health consequences. You may be wondering, how does stress work? Well, when our body first detects the stressor, the hypothalamus stimulates the pituitary gland, which releases a hormone. This then stimulates the adrenal glands to release the hormones epinephrine, norepinephrine, and cortisol. These increase blood pressure, respiration rate, heart rate, and the fuel source for our muscles, which is glucose. This cascade of events is perfectly normal and can even be life-saving in necessary short-term situations. The problem is when this stress becomes chronic. It can become dangerous. According to Dr. Lori Mueller, the effect of this chronic stress on our adrenal glands changes the chemistry of our bodies with this constant release of hormones. It eliminates our body's ability to regulate an inflammatory mediator. These consequences of deregulation have been linked to life-threatening conditions such as autoimmune diseases and even cancer. Chronic stress can also speed up aging. During cell division, the end caps of our chromosomes, called telomeres, become shorter. It was recently discovered by Elizabeth Blackburn and her colleagues that the shortening of these end caps is related to disease and aging. Unfortunately, lab studies have shown that cortisol, which is released with stress, can reduce the activity of this enzyme telomerase, which fights the shortening of telomeres, linking stress to faster aging and several other diseases, which include diabetes, depression, and even heart disease. Speaking of heart disease, the University of Rochester's Medical Center Health Encyclopedia writes that stress can indeed increase your risk for heart disease. High levels of cortisol from chronic stress can lead to an increased blood sugar, blood pressure, cholesterol, and triglycerides. These are all common factors that cause heart disease and can also cause a buildup of plaque in our arteries. Aside from physical health, stress can also put us at risk for developing mental illnesses. Because stress leads to things such as aches and pains, anger, sleep trouble, and decreased energy, it can onset mental illnesses such as depression and anxiety. Chronic stress can also lead to burnout, which involves total exhaustion, lower performance, and less motivation. Interestingly enough, burnout is most common in helping professions, which include nurses, doctors, psychologists, and social workers. So the range of hospital workers. While all these effects of stress sound scary, there are plenty of ways to manage and control it. Meditation has proven to be successful in managing stress. This involves a period of quiet relaxation and a focus on the senses. It has been shown to better the connections in parts of the brain and even lengthen telomeres if practiced consistently. This could lead to the reversal of aging and the overall long-term effects of stress. Exercise can also be a healthy stress reliever, as it can increase the body's neurotransmitters and have a positive effect on mood. Another solution suggested by the website Good Therapy suggests talking to a supportive person about your stress and seeking their help. Because it's best to seek help externally and avoid keeping your emotions and feelings inside. Seeking therapy can help individuals to have someone moderate their stress relief process and provide coping mechanisms specific to their situation. All of these are valuable mechanisms to combat everyday stress. People, especially in the healthcare profession, experience stress very frequently and on a daily basis. Given this, it is vitally important to understand how stress works and affects our bodies. With its potential to cause life-threatening diseases such as cancer and autoimmune conditions, putting in place coping mechanisms to combat stress could be life-saving. Today, I invite you to reflect on the stress in your own lives and attempt to put into place some of the coping mechanisms we discussed. Next time your workday is half over, you still need to assess patients and pass meds, and your lunch break is far away. Consider relaxing your muscles, taking a breath, and remembering, it is not worth it to stress.